5 days a week, I work with people in various stages of recovery from addiction. Over and over, I'm confronted with the devastating effects of this disease. Homelessness, joblessness, depression, psychosis, loneliness, parents not able to have contact with their children, intelligent people who can't hold a job, young people with serious medical problems, lost limbs, HIV, hepatitis, people serving time in jail for drug-related crime. As much as I want my patients to do well, as much as I want to relieve their suffering, I can't make anyone stop using, and in fact, that is not my job. My job is to give people the information and objective feedback they need to help them make better choices. Recovery from addiction is a long, arduous process, a constant battle against a culture that glamorizes substance abuse and stigmatizes addicts. 1 in 16 adults in America is living with a substance addiction, if nicotine is included. Nonetheless, 90% of people who try alcohol or marijuana will not get addicted. So why worry? Because 10% will get addiction, and addiction is devastating. Addiction is a chronic illness that ruins the lives of individuals, their friends, and their families. None of the people I treat, not one, planned on getting addicted. We know 10 out of every 100 people will get addicted. What we don't know is which 10. I know you've all heard the statistics and the horror stories. Before you tune out, keep in mind that although it probably won't happen to you, it almost certainly will happen to someone you know, and maybe even to someone you love. I see the consequences of addiction every day. It doesn't always make the headlines, but it is always painful and heartbreaking, and I'm here to tell you that it is avoidable. We can't predict for sure who will become addicted, but we do have some hints for who is at risk. 97% of addicts begin use before age 21. Let me repeat, 97% of addicts begin use before age 21. You can reduce your risk to a nearly negligible 3% just by waiting to begin use. The adolescent brain is still developing. This means youth are more likely to underestimate risk and that substances are more toxic. The amounts of alcohol and marijuana that are considered safe to a fully mature brain are poisonous to a developing brain. Do you remember what I said about waiting until you're 21? I can almost guarantee you that you will not get addicted if you wait until you are 21. Risk increases with a family history. The more relatives you have who have a history of addiction, the higher your risk. If you know of even one family member who has become addicted, you are at increased risk of addiction. We've known for a long time that addiction leads to brain damage, and we can see that brain damage on functional MRI scans. Very recently, research is beginning to identify brain abnormalities in children before they begin drinking. An MRI study of 40 kids showed that kids with abnormally low brain activity in regions involved with memory were significantly more likely to be drinking 3 years later than their peers who initially had normal scans. We're not at the point where we can use brain scans to identify kids at risk, but it's clear that we will be sometime. For the present, understand that there are biological factors which put some kids at higher risk than others. It's not just a matter of self-control. We all tend to think we can control our drinking, but some of us are going to have a harder time with that than others. Mental illness is very prevalent in our society, as many as 1 in 4 Americans has a diagnosable mental illness. And all mental illness increases the risk of substance abuse, especially untreated mental illness. If you're suffering from anxiety or depression or ADD, get help. Treatment reduces your risk of substance abuse. If you live in a subculture where substance abuse is prevalent or accepted, your risk is higher. This applies not only to high rates of crack use in neighborhoods with crack houses, but also high rates of alcohol abuse in suburban neighborhoods with high expectations that adolescents will drink. Many of my patients grew up in West Hartford, went to West Hartford schools, and still have family living in West Hartford. Addiction does care who your friends are and what they're doing. If the people around you are using, you're at higher risk to use and to become addicted. We have no diagnostic tests for addiction. We can't run x-rays or draw your blood or even see addiction on a brain CT scan or MRI. Truth is, we don't even entirely agree on how to define addiction. But we have gotten better at screening for addiction. Screening means developing a test that identifies almost all of the people with the disease. If you're screened in, you might not have addiction, but you have something to worry about. If you're screened out, chances are good to very good that you don't have the illness. My favorite test for adolescents has just 6 questions. Go ahead and think about what your answers would be. Have you ever been in a car driven by someone, including yourself, who was high or had been using? Have you ever used a substance to relax or to feel better about yourself or to fit in? Have you ever used a substance while by yourself? Have your friends or family ever told you to cut down on your use? Do you ever forget things you did while using drugs or alcohol? And have you ever gotten into trouble while using? I will share the results with you later, so remember the number of yes answers. Got it? And here's a screening test for the adults in the room, even easier. 1 question for alcohol, 1 for drugs. How many times in the past year have you had more than 4 drinks, women, or 5 drinks, men, on the same occasion? And how many times in the past year have you used illicit drugs or used prescription drugs for non-medical reasons? Remember those 2 numbers, and I'll let you know what they mean later. In the meantime, you, parents and athletes, need to stack the deck in your favor. You need to beat the odds. Easy answer: do not use before age 21. Even if you're convinced you are using safely, you're putting your peers at risk. You can't know who of your friends is at risk, but chances are at least one of you is. Stay sober for each other. Think back to grade school. You may not have been the child with the peanut allergy, but you were happy to leave your peanut butter and jelly sandwich at home so you could sit at the peanut-free table and keep your friends safe. It may not seem the same, but it's really not any different. Staying sober is going to protect some of you, about 10% of you. You just don't know who. You're active in athletics. This is a good choice. Student athletes actually use at lower rates than non-athletes, so stay involved in sports. Next, know that by choosing not to drink, you're not as alone as you think you are. Far more of your peers are either not using or don't want to be using than you realize. In the polls you take, students always overestimate how many of their peers are using and underestimate how many are abstinent. Don't be afraid to admit you don't use. It is not only possible, it's not unusual to graduate high school without using. In fact, 72% of teenagers report not drinking in the past month. That's 4 or 5 weekends of not drinking, smoking, or otherwise getting messed up. Even students who are using are often doing so reluctantly. Don't assume you're the only person who doesn't want to participate. Identify each other and hang out with each other, and know that you are the leaders and not the losers. Finally, if you think one of your friends is in trouble with drugs and alcohol, tell them you're concerned, you care about them, and you don't want to watch them get hurt. Same for parents. Do not make the assumption that your child will inevitably be drinking. Your job is to be committed to your child not using before they reach the age of 21. You heard it here, now you are informed. Children are at higher risk for addiction if they begin substance use before age 21. You put them in a car seat, you made them wear a bike helmet, and now I'm telling you, you cannot allow or condone drinking, marijuana, pain pills, or any other substances prior to age 21. Any other stance is a cop-out. It's an injustice to your child, and it is bad parenting. Forgive me if I sound a little preachy or zealous. Please understand where I'm coming from. I don't want to see your kids in my office or any other substance abuse treatment facility. It breaks my heart when I hear about kids becoming addicted, because I know what is ahead for the child and the family, and it is often years of anguish. In thinking about this talk, I began telling my patients that I'd been asked to give a substance abuse talk to high school student athletes, and asking them, "What do you wish someone had told you when you were in high school?" That is the exact question I asked, and I became careful about asking it just like that because so many people answered a seemingly different question. Keep in mind what I ask as you read some of the answers I got. I never mentioned parents at all, yet an overwhelming number of my patients poignantly spoke to a lack of parental supervision and oversight. All of these people were already using in high school, and all of them years later were crying for their parents to help them stop. Kids may say they don't want to hear it, but deep down inside they do. They want you to set limits. They want you to say no. Please, please think twice about being the cool parent who provides a safe venue for your kids to drink. It is not cool, and it is not safe, and you are kidding yourself if you don't believe me. If you don't take anything else away from this talk, please think about the messages you are giving to your kids. It takes a lot for your kids to say no. You owe it to them to say no first. Be encouraging and supportive. High school may be the first time your child faces cuts or sitting on the bench. This can be difficult for parents as well as students. It's essential to differentiate your frustrations and anxieties from theirs. Keep your questions open-ended. What do you like about playing soccer? Is there anything you don't like about cross country? Why is this important? Because sports should be a source of stress reduction and not added pressure. Don't make them worry about living up to your sports expectations on top of their own. Will playing a varsity sport be stress-free? Of course not. That's why your role is to help them manage their stress, not add to it. Talk to your child about addiction. Kids who report talking with their parents about the danger of drinking and drugs are less likely to use. However, only about 60% of kids report doing so. This means 40% of kids never hear no from their parents. As I said before, that's irresponsible. You don't have to lecture or accuse anyone of anything. All you have to do is let them know that you, as their parent, do not approve of underage drinking or of any drug use. You believe it is dangerous and potentially very harmful, and therefore your expectation is that they will not do that. If you are in that 40%, tonight is a great night to start. Make sure your home is a safe home. If you use alcohol, use responsibly. Make sure you safely dispose of any unused pain medication. Mix it with coffee grounds and throw it in garbage. If you take pain medication, keep it out of sight and keep track of it carefully. Don't let your medicine cabinet be a source. Most prescription pain medication is opiate-based. In other words, it's no different from heroin. More and more people who are addicted to opiates have never used heroin. They're addicted to pain pills, which is no different, which means it is highly lethal. In 2007, someone in the U.S. died by pain medication overdose every 19 seconds. Death by prescription pain medication overdose are greater than deaths by heroin and cocaine overdose combined. Pain meds are controlled substances for very good reasons. Do not treat them lightly. Get to know your child's friends and families. Host team pasta parties. Go to games and meet the other parents. Monitor your kids, know where they are, and make sure there's a responsible adult around. Here are the test results. Parents, if you answered anything other than 0, you would be screened in for further assessment. Your use is risky at best and should be addressed. Students, if you answered 2 or more, you would be screened in for further assessment. Your use is risky and should be addressed. This might be hard to believe, but please trust me, it is absolutely true. But here's the good news. Treatment works. So if you're concerned, reach out for help. It's out there, and it works. I want to close with the words of one of my patients. I got a bunch of eloquent and thoughtful responses to my question, but of all of them, this one touched me the most. He's talking about heroin, but his lesson is universal. Life really is about making choices. My hope for all of you is that you never sell yourself short. Stand up for yourselves and for each other by making the healthiest, safest choices you can. Thank you.